Okay, Google Health. Take a deep breath for this company. There's quite a bit going on. It started back in 2008 when Google was just Google, and they launched a personal health record. They called it Google Health. What was telling about this early experiment is that it proved that the usual Google playbook wouldn't play. They built something, they gave people free access to data to manage their own personal health info, but it never scaled beyond the worried well and the already healthy folks who already keep their health records up to date. The project was shut down later in 2013. So let's jump to 2014, when Google tipped their toe back in a big way with the launch of Calico, earning the cover of Time magazine with the question, can Google cure death? Soon after, Google acquired DeepMind, the leading deep learning research company in AI, and a precursor to larger health grand experiments later on. The company announced a number of partnerships, one with Novartis to create this smart lens to detect glucose for people with diabetes, a partnership with AbbVie and Calico to co-develop anti-aging treatments. Google developed a star-like tricorder, and their DeepMind division partnered with the NHS on a large-scale patient data initiative. Around this time, Google made a massive change itself. The company was reorganized into a holding company called Alphabet. Google, the cash cow advertising business, was given a clear structure. Meanwhile, all of Google's moonshots were organized into separate companies. Calico was one of them, and soon after Verily were cited as examples of what we refer to as, quote, other bets, unquote, on the company's income statement and balance sheet, giving investors a clear number. What was the company spending on these crazy moonshots, and what were they earning back? This new organization unleashed a massive explosion in activity in the health space as partners were eager to join in Alphabet exponential bets, and leaders of these various divisions aimed their sights high. So Verily was formed as a life sciences company, earning partnerships from 3M to co-develop solutions in population health, GSK to co-develop bioelectronics medicines, J&J to form Verb Surgical for surgical robotics, partnership with Sanofi to form Onduo to develop solutions for people with diabetes. A company called Apogee was acquired. This company provides APIs to help companies and systems set up interoperable data systems through APIs, and their strength was in hospital systems. Okay, so soon after, DeepMind achieved a major milestone, winning the first Go competition after facing off with a human and proving Google's prowess at amassing what some believe to be the most powerful AI team on the planet. Yet only a few months later, DeepMind suffered a major stumble, winning with a data breach that discovered that an agreement failed to comply with the Data Protection Act in DeepMind's partnership with the NHS. Meanwhile, another Alphabet company, Sidewalk Labs, focused on city data, decided to spin out something called CityBlock Health, a community health service targeting underserved urban communities, launching in New York City. Google also launched the famous Baseline study, then a Verily watch for health tracking, so they didn't have to use those pesky Apple Watches or Fitbits. And partnership activity included Gilead and Verily to understand immunological disorders, ResMed to co-develop solutions in sleep apnea. Along the way, Google Ventures has taken big stakes in leading health tech companies, from Flatiron Health to 23andMe to Oscar. Finally, in late 2018, we can take a deep breath. You can step back and see this is a lot of activity. So the Alphabet leadership recognized that all of this activity needed reorganization. David Feinberg, former CEO of Geisinger Health, was hired to oversee all these initiatives, organized as Google Health, including efforts from Nest and Senior Health. The biggest clue to Alphabet's long-term vision, let's take a look who Feinberg reports to. He reports to Jeff Dean, the company's head of artificial intelligence. Now, along the way, Google has developed a reputation for lots of activity, but not much follow-through. The tricorder was shut down, the Novartis Smart Lens was shut down, partnerships have been ended, key talent at Verily has departed. The DeepMind NHS contracts are even more in jeopardy now that the company DeepMind reports directly into this new Google Health structure and might further violate that NHS contract. And more importantly, trust in the overall system. Now here's where we talk about the business models in play. You'll see Google's favorite, free data as a service. followed by smaller efforts to build services as part of Google Cloud's positioning within the health sector, charges a web services pay-per-use or data service model. Alphabet is also exploring outcomes-based or performance-based payments, but the reality is that all of this exploration has been operating under a build first, learn the business model later. So this is a Reason Street editorial theme. Building the technology first, waiting for the business model to follow. This strategy worked for Google in the beginning, but it will not work in healthcare. Through all of this activity, it's not clear that there is a cohesive strategy. Most initiatives have been in the form of high stakes, long-term, moonshot, exponential bets without an overarching commercialization plan. What could be exciting is if Google uncovers some kind of leapfrog in how therapies are discovered with all of this compute power. What may be the roadblock for Google is not getting how healthcare economics work, the whole system of healthcare, and never really moving beyond these grand schemes. So in 2019 and beyond, look for how this new org structure with Google Health and this health systems thinker at the top will fare, an actual strategy that may start to emerge from their tremendous strength in artificial intelligence.